Hometown Radio, KGAF FM Stereo 92.3 Thursday morning. And as we mentioned earlier, special guest on the program today is North Texas Medical Center's regular Thursday program. And you've heard us talk a lot about the new wound care clinic there at NTMC. And one of the folks associated with that is Kelly Clark. She is a nurse who works in the wound care clinic, and she joins us via phone line today. Hi, Kelly. How you doing?
Good morning. I'm doing great. How are you?
I'm doing well, It's great to talk to you, and it's great to have a wound care clinic locally that folks can go to. Having gone through this in my family several years ago, I know how important it can be. Let's talk first about how patients even know if they have a wound that's not healing properly.
Well, typically, if you have any kind of a wound or an ulcer or disruption in your skin, it should heal by 50% within 4 weeks. And if it doesn't, then there could be an underlying problem that's keeping that wound open.
And what are some of the underlying problems? I know that a lot of times diabetics have trouble with wounds healing properly, but what are some other things that may cause that?
It could be malnutrition. It could be venous stasis, or if you have a lot of swelling in your lower extremities. And some people have autoimmune problems that can cause wounds to heal too slowly.
So then I guess that begs the next question. Why is it so important that someone gets to a wound care center when a wound is not healing properly?
Well, the most important thing with a non-healing wound that people need to worry about is infection. In particular, you hear the word sepsis or a bone infection. Once the infection gets into the bone, that could lead to an amputation. And infections, they can lead to serious health issues and hospitalization and even amputations. Patients with other conditions like diabetes, they just take so long, and so their risk of infection increases.
Well, let's talk about the types of wounds that you guys treat there in the NTMC Wound Center.
We see all types of wounds, a wide variety of wounds. We see diabetic foot wounds, venous and arterial leg wounds, surgical wounds that aren't healing properly, radiation injuries. We see traumatic injury wounds such as a crush injury or dog bites. Those are just some of the wounds that we see.
Yeah, and I've always heard that a lot of times abdominal wounds are the toughest. Is that true?
They can be, yes, because we use our core muscles in our abdomen, so we're constantly moving those muscles and disrupting those tissues when they're trying to heal.
All right. I guess probably most people may go to their family doctor or whatever at first for something like this, but why? What does the wound center offer that maybe their family doctor doesn't?
So at the wound center, we have access to advanced wound care products, dressings that you don't typically see in a doctor's office or even at your local pharmacy. We also work closely with your primary doctor and other doctors within different specialties, such as plastic surgery or vascular, or sometimes, much of the time, podiatry.
We haven't really talked yet about the treatments themselves. What type of treatments do you offer?
So in some centers, and we can evaluate for this at our center there at North Texas, some centers offer hyperbaric oxygen treatment for wounds that are very difficult to heal and wounds such as radiation injuries. We also use techniques to remove the unhealthy tissue from the wound bed so that this is called debridement. And by removing this unhealthy tissue, the wound will start to respond more to treatments and dressings, and it stimulates the healing process. And we have access to, a wide range of specialty dressings that can help with this as well.
And there, as I recall, I've seen this. There is a machine or something you can actually cover it with and seal it with that actually works to help it heal as well, isn't there?
Yes. Those are negative pressure wound therapy. We have those. We can also offload the foot using casting. We have a specialized, what's called a total contact cast. We can use that. And we also have a special skin graft material that we can apply to the wound.
Well, I do know the wound care clinic is very valuable to the folks in the Gainesville community and around Cook County, and we're very fortunate to have you guys at North Texas Medical Center. Tell everybody where your clinic is located and how they can get in touch with you.
So we are located in the North Texas Medical Center Hospital. You can just go right there to the front desk, and you can call our front desk coordinator to help get an appointment. You don't necessarily need a doctor referral. Some insurance do require that. That number is 940-612-8490. And they will help you get an appointment and help you with your insurance authorizations as well.
All right, very good. She is Nurse Kelly Clark with the North Texas Medical Center Wound Care Clinic. Kelly, we appreciate your time this morning, and thanks for joining us.
Thank you so much.